I will start with the introduction then now. So good afternoon, everybody. Thank you very much for joining this week's noon meeting, which is hosted by the Center of Environmental and Occupational Health. I'm very pleased to introduce my collaborator, Gueladio Cisse, who's from the Swiss Tropical and Public Health Institute in Basel, Switzerland. He's the head of the Ecosciences Health Unit at the Department of Epidemiology and Public Health at Swiss TPH. He's also one of our lead collaborators on the bilateral chair in global environmental health, leading projects in the area of climate change and health and water pollution. And today's presentation will be do a presentation on studies that we've done that is done in South Africa in collaboration with various South African collaborators in the area of climate change and health. So, Gueladio, please.
So I don't know if I can share my screen. So how can I do that? I have to come back here. And because I'm not used to open share tray.
Do you see next to the mic?
Well, how can I find browser? Okay.
Do you see next to
Upload
the
from
mic?
my computer. No, I'm coming.
Okay.
I'm not used to Teams, so sorry for the. So I have to go to Akiel's folder. It's something like that. Oh, that's this, and it should be this one. ECT noon meeting, Gueladio Cisse. So I have to open it. Now you should be seeing it. Is it coming?
Not yet. It's probably still taking time. It's coming.
Okay, you have seen it now.
Blank at the moment. It's blank at the moment, but it's probably.
So I'm seeing it now as shared.
Yeah, it's running. It's not visible yet, but it's there. We go.
You are seeing it now.
Yeah, we're seeing it now. Thanks.
So now I can walk as I do with Zoom. It means if I press it, going to the next slide is how it would be. Yeah.
Yeah, it's the same. Yes.
Okay.
That's
the same as. Okay. So welcome to everyone. Thank you very much for giving me this opportunity. As Akel has said, page down, he started to talk about my background. Let me see if I didn't jump. I jumped one slide more. So I am my background is sanitary engineering, and I did a master in environmental sciences after that, and then I did a PhD, which is combining sanitary engineering and epidemiology. Then I moved into disaster risk reduction, advanced studies, some continued education trainings on environmental epidemiology. And I was based in Mauritania first before going to Burkina Faso, Ivory Coast, Australia 1 year, and now I'm in Switzerland for, let's say, 12 years now. So the collaboration with Prof. Akel and Prof. Martin Rusley started in the frame of the Joint Chair on Global Environmental Health. And currently, I'm also member of the Ipcc Working Group 2. We are completing the elaboration of the sixth assessment report that's going to be released in March 2022. So on climate change and health, I'm on that for some years. And in the chair, there were 4 projects, and one of them was about climate change and health, and I'm contributing in that line of activities. Still going on my background with regard to particularly epidemiology and climate change, I got some continuing education trainings in different parts of the world, but I tried all the time to keep a focus on water, sanitation, hygiene-related diseases, and climate change. That's why I'm not too much far from hygiene condition, be it habitat, be it at community level, and so on. So the ecosystem health sciences unit in Swiss TPH is from the Department of Epidemiology and Public Health. So we are at the crossroad of several other projects within the department and even beyond the department, be it from the medical parasitology and the infection biology. So we are at the crossroad, trying always to link environmental conditions, related diseases or health outcomes with climate change. So my collaboration with South Africa, I said it already. We had a collaboration with the University of Cape Town and Ipcc on this global chair in the global environmental health. But we started another collaboration with the University of Pretoria and South Africa Medical Research Council very recently. It was in 2019, even 20. It's in the frame of a call that has been launched for seed money grants, encouraging collaboration between new partners, and have been approached by teams from that university saying, what can we do together? And then we moved around a proposal that we submitted and that succeeded to be granted. It's on climate change and cardiovascular diseases. And we were not too much ambitious. We're saying, let's start by just trying to explore what could be coming out of a former project that ran for some years, and that got 15 years of data records from hospitals about several diseases. And they said they worked on diarrheal diseases and pneumonia, something like that, but they never worked on non-communicable diseases like cardiovascular diseases. This is from the interaction with me when I read that I have one PhD student working on cardiovascular disease already. Then they were interested by this topic, and maybe we should try to dig into the data set and find out how the cardiovascular disease can be linked to the recourse with climate. So this is how it is. So what I'm trying to bring in this meeting is not presenting a complete scientific study from the hypothesis to the methods and to the research, but rather to go through what were our thoughts, joint thought on what kind of research questions we covered or we were concerned with to undertake some case studies, for instance, in Cape Town, and what kind of question we started to work on in some case studies in Limpopo, and then end up by what lessons we can take from what we are doing in Cape Town or in South Africa in general, but what is now under discussion all around the world, and how could be the ways forward in our collaboration in South Africa. And then I hope that it will be enough for material from which we can have a discussion. So the third part, what were the main research challenges on climate change and health when we were starting this collaboration? Just a few slides to share with you. First, Ipcc, we all know that the Intergovernmental Panel on Climate Change has, I think, impulsed the attention of even the political world on the processes that are going on and that needs scientific assessment, really focusing on it and trying to better understand what is there. It's very complex because it's coming from understanding the physical condition that lead to any temperature or rain or something like that, but to what are the impacts on several dimensions of the life on Earth. So this is just to highlight that there were 3 working groups of Ipcc. They call them working group 1, working group 2, working group 3, and each of them has to release a specific scientific assessment report. And these three groups should be covering the main areas of scientific questioning that is about climate change. So the three groups are the first one is about the physical science basis. The second group is about climate change impacts, adaptation, and vulnerability. And then the third group will be looking at the mitigation of climate change. So we, in the share, when we are discussing about the topic that could be covered, it should be linked somehow to the other project that Akel was putting in front. For instance, the pesticides project or the air pollution project, and what climate change and health component could be bringing on top or in synergy with the other topics. So as you can imagine, we'll not go into the physical science basis. This is not our areas of competencies, be it Akel, myself, or Martin. And then we went rather on the second group questions about impacts, what kind of adaptation could be done there, and what kind of vulnerabilities are around. And as everything was about, at the core, this agricultural world with the pesticide that are used and how this, we were trying to start climate change and health also on those kinds of topics in the Cape Town collaboration that we're starting. So again, just a reminder, we said basic sciences, that is not what we intend to do. Mitigation is not also what so we were really wondering about adaptation. What are the research, what is the research that could be, yes, helping to go for some action that will improve the day of the targeted groups that we are putting under study. So I start by showing this graph where it summarizes also somehow the challenges in hand. You have all on top here, all the hazards that are linked to climate change processes, but there are some factors that are between those hazards, climate-related hazards, and the health outcome as such. So the research is through all this. It means some researches are more social scientist oriented, where they try to better understand what are the vulnerabilities, components of the groups. Some are looking at the exposure, how the water, how the air, and so on. And then some are maybe having the entry point, taking one outcomes, as I will highlight later, trying to, where do we start? Do we start by looking at chemicals and the risks associated to them? Or shall we start looking at what is a major health outcome in the area that is really climate sensitive, or something like that? And you'll see why in our first ideas, we were looking at chemicals, but then at the second stage, we said the diarrheal diseases, which is also important for water quality project, how we could be looking at climate change and diarrhea and things like that. So we could do a number of studies on hazards, on vulnerabilities, on exposure, and then on some outcomes. And then the idea or the interest would be to end up with some key risks that could be scientifically highlighted, showing what are the vulnerable groups around those studies, and then looking where we can maybe end up with some responses in some hotspots. So it's the whole chain of from hazard to risks. So the range of health outcomes, I'm putting this PowerPoint from the CDC, where the complexity that I'm trying to show, and also the potential of studies that we could do is well illustrated here, where from different climate-related features or hazards, you could have through several mediating factors impact on many health outcomes, including injuries, mental health impact, cardiovascular diseases, and so on. So I will not also talk a lot about this, but just to illustrate that we had this in mind in the collaboration, and we were always trying to find the way of starting something that is relevant in the South African context or in the Cape Town context. So for the Cape Town context itself, what have we covered so far? The first intention, when we looked at the frame of the manners of work, like this example of this slide that we presented in the report of the chair to the Center of African Studies in Basel. If you look at what we are doing in 2020, we had the pesticides project running, we had the air pollution running, and we have climate change and drought-related studies that are going on. And water quality project had some studies before, but not in 2020. The first idea of research that we wanted to undertake was with one, South African PhD candidate, Lucinda, who should be supervised by Akhil and myself. It should be a PhD study on how one could further explore on climate change, ecosystems, pesticide usage, and health. And as she was, I think, a social scientist, her PhD would be focusing on assessing major vulnerabilities and going into adaptation challenges, as she was also a very active person in the climate change adaptation dynamics in Cape Town City. I think she was working at the city level before, and she was working also in the there was an association for urban cities. But this couldn't flourish. It means that for some private and family matters, she couldn't complete that PhD. And then we moved to some other studies from the Swiss TPH perspective. And one of them was the one that has been completed in January 2020. It took place in 2019. Before we got some studies on water and diarrheal disease, but I'm not highlighting those because the title is mainly about climate change and health. So I think this master is the one that really went somehow a little bit deeper on the climate change challenges or questions about climate change in Cape Town. And there were some studies before by some South African people who did some studies on diarrheal diseases and temperature. But here we wanted to bring additionally on board the dimension of drought. So emphasizing on the period between, I think, November and April, and how the dry season and the drought challenges in Cape Town could be affecting diarrhea. So Tristan Lee, she's from Canada, but she did her PhD, her master studies with from Swiss TPH. It was a master in epidemiology, supervised by Akhil, myself, and Martin. And I said completed in January. I will not present all what she went through. It was challenging because it has 3 objectives, but one of them, which is about understanding the linkages of diarrheal disease with the periods of the climate-related periods. So I will just take one graph from her study. So first, the study found a positive association between incidence of diarrhea with dehydration in children under 5 and increasing temperature and relative humidity. And the interviews that she could do with stakeholders showed that many of them are seeing drought as a how we wrote at that time. It's a kind of eye opener on what we could say the challenges ahead with if drought is going up like this. So how health should be suffering. But one aspect of the work that Tristan Lee conducted also is that the disease, the diarrheal disease rate in children under 5 is decreasing at a certain period of the year, and high some seasons of it. And March, around March, April is where we have the peaks, and there are slower peaks happening somewhere here. So the study could at least highlight that there is an association that is positive between these incidents and the increase of temperatures in the period that you can imagine from this graph. So for me, I think this was a very interesting output of our efforts in having some studies on the diarrhea, climate change, drought. And what followed this, and I think it's the credit of Akel and his team in South Africa. They initiated a review on drought and health in South Africa. It's a paper by, I think it's Asma, if I got the name correctly. And it has been published recently. It was published, I think, in 2020 or 2021. So this is what could be completed so far in Cape Town. But we have in the pipeline another study that is now a PhD study. And this is conducted by one Indian student registered here at the University of Basel for a PhD in epidemiology. And the title of her PhD is The Effects of Climate Change on Cardiovascular Diseases, what the future could look like, not only for South Africa, but also for India. So the main questions are, how can we find an association between CVD mortality and incidence and apparent temperature in Cape Town and Puducherry in India? So the study pretended also to go into the attributable risk of climate-related CVD mortality with projection. And we are now bridging with very strong teams in UK to be able to do this, because this is something that has not been yet done. And then we included at least some questions about the stakeholders' perception and how the strategies are felt, or the awareness is strong at the level of some authorities. And then the last research question is about what are the existing policy and plans related to not only CVDs, but non-chronic diseases in general. And are there some gaps that could be leading to some recommendation from our side? And this PhD is supervised by, again, Akel, myself, and Martin Rusley. And she started in November 2019. She's then already in her second year of PhD. And we hope that she could complete at the end of 2023 or mid 2023. So she still have the whole 2022 to work. We are expecting that she could come to South Africa, and we are looking for the signal by Akel saying, hey, yes, you can come now, and then she will take her flight and come to Cape Town. So I think starting on the non-communicable diseases with this PhD is something very strategic. And as you can see later when we go to Limpopo, because it has been like a door opening for, yes, going for some similar studies in Limpopo. Now, I will take you to the Limpopo context now. And we started with this. What is the apparent temperature and cardiovascular disease linkages? And it was about undertaking a time series analysis of hospital admission data in the Limpopo province, South Africa. This master study is in the frame of our collaboration with the Karolinska Institute. It's a master from the Karolinska Institute in, I think it's public health and epidemiology. And they undertake very often very short master study field work. They have, I think, in total 6 months. It's from January to June. So they can't undertake themselves the field data and then go for analysis. They need to start with a place where there are some data set waiting for analysis so that they can really increase, they will have more time into, more of the time on data analysis. So it's what we could do with I can say with Jacqueline, and Jacqueline started in January, and she completed her master in June. In June, she handed in her masters. So just to highlight again a few results from what has been completed is what I did with Tristan's list work, because it has been done, the master is in hand, and then we are now encouraging Tristan to go for a paper. She's working on a draft, but things are getting delayed, and she took another job, and now we are trying to push her to succeed to have a paper. Maybe we have to help her to complete this paper in a way or another. So now we are moving to Jacqueline. So Jacqueline also completed her work, and she did a very good job. So what I can show from Jacqueline's work is the quality of the data that we found with the partners in Limpopo. So we got hospital admission data from I think 2009 until 2016. But before we got even more, I think they had almost 15, but due to cleaning matters, we kept only data from June 2009 and December 2016. And for the hospital admissions, we did the same. And if you look at here, how it's happening over the temperatures, how it's easy to make the link between the temperatures and the hospital admissions. I will not present more than that, but there is another graph that I want to show you. It is how she plotted the TAP over time, depending on the period of the year, and it's like a variability that is happening. The main results she found is that there is an increase in cardiovascular disease admissions for warm temperatures between 27 and 32 degrees Celsius, and also in the lower temperature, in the specific cold, when it's between 12 and 24 apparent temperatures. And this accumulated over 21 days. So the increase of cardiovascular disease admission due to warm apparent temperatures appeared immediately and lasted for 2 to 4 days. But what she said is that it's inconsistent in some way. So I think this first study on non-communicable diseases, due to the lack that we have to get access to some data set that is, it was very complicated, but at least the cleaning made it possible to come out with something that could be also interesting as a start. So this could be, how can I say, an example to look for in Cape Town area. But anyway, we'll see. We are in the process. Jack, how can I say, Shreya, as I said, in Cape Town block of activities, Shreya is now starting the PhD. She submitted all the requests for getting the data set on health, but the data set on climate. Things are moving on. And there are two objectives about qualitative and stakeholders. This, we hope that you can do it by coming on spot there. as Tristan did, but we are waiting for that. But Jacqueline's work on the link between cardiovascular diseases and temperature was a good opening, door opening on that non-communicable disease area, and it can be widened to some other regions. And now we have, right after Jacqueline completed her master, we recruited a new master student because the seed money project is running now until December. So we said we still have the opportunity to have one master's thesis on that, because all the climate-related data set have been cleaned and very good to be worked on. And then you have all the health data set, depending on the outcome that you want, need some cleaning. But then we discussed among us, and we said, what could be the next topic that we could be working on the health data set? Because I asked for cleaning again, clarifying the mention that were there. So we went for respiratory illnesses. So this is what Daniel Kipo, he's from Ghana. He's also undertaking a master's thesis on epidemiology. And it's supervised by myself and Karadi Wright, and also Martin Resley. And we have Shreya, who is as a PhD student. We are encouraging that in our institute, that PhD students can really be involved in mentoring and coaching master students, especially if they are in the same area of research. Unfortunately, it was not in Cape Town, because this could be more synergetic when the master student is also in the same study site of the PhD student. But in this case, topical-wise and also methodological-wise, it is good for her to follow a student who is working on these matters in Limpopo, as she did also with Jacqueline Buller. So now, for this study, we said Daniel should also be looking at the potential link between temperature and respiratory diseases among those people who were admitted to the hospital, the same data set. And then we asked him to now look at the vulnerabilities of school to heat, for instance, or for some other hazards, and teachers. So the original idea is to go from schools to even households, but then at the end, for practical matters, we will stay only at the level of schools, where he will be exploring what are the vulnerabilities at the school level for school children that could be increasing the risk of respiratory illnesses. And this could be in hot, but in cold. Very often people, when we talk about temperature, people think at the heat, but then the cold is now becoming also a matter of concern currently. And then we said in the flow of his master, he could be asking also on what are the existing adaptation strategies and how effectively, if these have been implemented at national or local levels. And then what are the challenges and lessons learned from these adaptation, and how they can be applied to promote adaptation at national local levels. So this is again a study underway that started in June, and we hope that it will be completed next year in June. And we are always encouraging that the students complete their master with a paper. And Jacqueline is facing the same challenge as Tristan, because as soon as she completed her master, I was ready to take her on board for 2 more months as a trainee. I got even the money for that, to pay her trainee payment, so that she can work 2 months on her master's towards a paper. But then she got a job. She said she's not going for a PhD, but having a job, and she will see how the job is really challenging before taking a commitment. And then she said she will know in October. We are now in October, and now the team discussed last week, and we said, let's help him, as we said, let's help her, as we said, we'll help Tristan, so that if you count only on her, maybe the paper will not be out. So this is also something that is on the table to get a paper from what Jacqueline has completed and also what Daniel will be going to complete. So that's the main thing that we did in the collaborative research in South Africa so far. So now outlook and lessons. So if you look at the current trends on scenarios, and this I'm taking here a slide from the first released Ipcc AR6 report. It is the one from group 1, which is about physical science basis. And if you look at this, the summary is very simple. You have here plotted 1, 2, 3, 4, 5 scenarios, which is a combination of shared socioeconomic pathways and some representative concentration pathways. It's only two scenarios, common scenarios, that are really keeping the people below 2 degrees Celsius. All the others will take us out of there. So you have several calls that saying that climate change will go on affecting all systems. And every system that is impacted by climate change will end up by affecting health and well-being of people. This is true, be it food, be it water, be it forest, be it everything. See, everything that you can say as a system saying, it will be affected by climate. You can have very strong reports, scientific reports about that. But at the end, the final thing is that it's where people end up in connection with that system that is going to be important. So climate change and health is the human face of what we are discussing. And that's why WHO is taking it now as one of the 5th priority, the new Director General. And many of those Director Generals of WHO are saying that it will be the 21st century highest threat or highest risk for health. So I think the call that is coming out from many of the reports now is that we should move into the action and the tracking what are the actions that are needed. So the outlook of this is just for the discussion. I'm not the one deciding what we will be doing and what we could be doing. But I think from this experience, we should think of some studies that could be covering both Cape Town and Limpopo and even some other provinces. So the chair from the beginning said that it could go out of that, but we didn't start yet to do so. But I think this is a way forward. We started by now having a study that is covering both India and South Africa. I think this is a good way forward, and this will help us to think of some other examples. I've just got a new PhD student from Rwanda who joined us in August, so starting 1st of September. So he's here for less than 2 months. He's starting now to write his protocol, and I already told him, your topic was on Rwanda. So maybe if you could bridge it to another country like Burundi or maybe South Africa to have a synergy again. And he's open to that. So I will maybe follow up with Akiel and Martin how we can bridge with what Felix Rubuga is going to do. And then the third point is looking beyond risks and trying to look at adaptation. So I'm initiating one SNIS proposal, and I talked this about, I told this was last year that we wanted to submit something like that, which is about adaptation to one major topic involving 2 or 3 countries, and how we can go into that direction of responses. And then my wish is that we go to really larger grants for multidisciplinary projects. So if we are now at 12:40, I don't know if I should stop here. And thank you very much for your listening. And I'm ready for the discussion. And the more time we have discussion is even better. And I could also respond to more interesting questions if I missed to cover some points that you were expecting that I would talk about. Thank you very much again. Thank you.
Thank you very much, Gueladio. A very interesting talk and a very nice overview of your research. And so I open up, I see Amber's camera's on, maybe she's probably going to ask the questions. You made a comment in there, so she'll probably elaborate on that. So I'll open the floor for questions. Amber, you can go.
Thanks. I just wanted to thank you for the presentation and say that I'm excited to hear of potential overlaps between the work we've done. I know we've co-authored on that paper with Tahira, but hearing that you have other students doing similar works and just letting you know that we also at Future Water are looking to expand our scope in focuses on health implications of climate change, particularly around water access, and we have experience in Limpopo. So any kind of potential for us to chat about that is exciting. Thank you.
Thank you very much. Most welcome. We will do so. We'll move on that. Thank you, Amaya.
Okay. So any other questions by others in the chat?
Or comments? Someone, what we are doing also, I will be happy to hear. What is going on from since Asma's paper? What is also on the table?
Gueladio, I've got questions for you with regard to a lot of the challenges that we experienced initially in the area of the climate change and health projects was related to obtaining health data. So eventually we were able to get some diarrhea data, and we're working now on obtaining some data on cardiovascular and respiratory outcomes, which we are still waiting for. So how do you compare the challenges in obtaining data? And obviously that is complicated by the pandemic, current pandemic, the department being busy with the pandemic and not being able to get the data. How do you compare your experience here in South Africa, well, the Cape Town and Limpopo and that to other settings as well?
So whatever is the intention for an active activity, an active action, that has been affected. That's why it was a lack that some of the studies that we are implementing now are mainly based on available data sets. So I think this is a lesson to take and to maybe get an opportunity of strengthening the data collection at the level of health infrastructures, or even the system that are put in by WHO or some other projects. So I think this would be the way forward. We got a lot of lesson from this, and we hope that soon people can go. So all the protocols that I'm now supervising, I used to tell the students, I will say 2/3 of your work, we hope that it could be on analysis, deep analysis of available data sets. This is what I wish you to be able to, because this increases the chance that you complete something. Then maybe you can say 1/3 is about wherever possible. This could be postponed until we have a clear idea of what is going on with COVID. To have a qualitative component of your work, avoid a quantitative ambitions, so like the household surveys and yes, surveying for 400 people in 10 villages or something like that. So this is something that we have to now avoid. But at least some qualitative questions and objectives could be undertaken, because it will involve only maybe having some appointment with some people, key informants, or also even some Zoom calls or some focus group discussion you can organize. So this is a lesson that I could share with you. I think the pandemic affected the ambition that we could put on projects, but we hope to really get access to data sets that are available. So records of the past records. This is not easy. It's really difficult to wait months and months and months before getting your data set.
I understand what I've done.
Did I respond to your question, Akel, or did I didn't understand?
Yes. No, thanks very much, Gueladio. This is very good. Johnny, you wanted to ask something?
Can you hear me?
Yes. Yes.
I'm sorry, I switched my microphone on by mistake. I was having difficulty joining the meeting. I've only just now been able to join the meeting. My apologies.
No,
Who
that's
is
fine.
speaking? Who is speaking? I don't see the figure or the age.
It's Johnny
It's a
Meyer.
mistake. It's a mistake. Sorry. Apologies.
It's Johnny Myers who joined the chat. He is the former head of the department when we started off here, and he's now emeritus professor. He's joined. He's in retirement, but he is the head of the Centre of Environmental Occupational Health. That was before I became the director, and now Shahida is. So he's proud, but he just joined. He had some difficulties in joining the chat, but he's now joined us.
Okay. Johnny Myers, you said, huh?
That's correct.
Johnny Myers, I'm seeing it too. Yes, thank you.
Is there anybody else that would like to ask a question or make a comment, especially with in relation to some of the challenges, data from the various departments and so forth? If there's any other topic, anyone else that want to make a comment or ask a question?
So there is someone who wrote that I'm doing my MPH thesis on health climate change as reflected in NAPS. It is Renate Meyer, isn't it? Are you in the call?
That's correct. Yes. Yes. Yeah. So, she's also an MPH student that's working in that area.
Okay. Can she say a few things about what she's doing?
Renata, do you mind telling us a bit more about your research?
Yeah, sure, no problem. So I'm looking at obviously the national adaptation plans and of course adaptation strategies. I'm concentrating on the South African development community.
Okay.
And I'm looking at the aligned human health impacts in relation to direct and indirect climate change within those countries. So I'm reviewing the NAPs and the communications and all of that, but really trying to pull out the health impacts and looking at the type of strategies that different countries have used. I'm using 5 countries, looking at the strategies they've used, and also trying to think through whether top-down or bottom-up might be more appropriate, and to see if there's any similarities in strategies and how they're pulling out the health impacts. So this discussion has been absolutely fascinating for me. Thank you so much.
Thank you. Good luck. I think you are exactly on the what I said, from the hazard to the responses. We are really at a place where now many people are looking for evidence. So we want people to look at what is going on there. What are the projects that are implemented? Have the NAPs have been efficient, or anyhow, have they been helpful in countries to initiate a dynamic or to impulse something? So this is a very good topic you are working on. So good luck.
Thank you.
I'm supervising some PH with Prof. I can find that your old email. This is we'll send the proper culture email that way. What is your Amber? Okay, so we are seeing a message from Amber Abrams, but it is for some other people, I guess.
Okay, are there any other comments by the others? Or Gueladio, I know that you stopped at a certain point and you might wanted to say 1 or 2 things more. Is there anything else that you wanted to say?
No, I think it's all. I'm grateful that we got this collaboration. It's now running for, I think, 6 years, at least 6 or 7 years. And I think capacity building, training young students on this topic is, I think this is one of the major, how can I say, rewarding interest of this project. So I look forward for building on achievements from one study to another, and how we can. So what happened? Yes. So yes, I thank you very much for inviting me. I was also, I think, some weeks ago invited for this. It's a matter of profile by the university. One person, I don't know, someone has to present himself. I'm missing to come to Cape Town for now. How many years? Maybe 3 years now. So I look forward for getting the opportunity to come down there once very soon.
Yes, yeah, most welcome. We're also looking forward to when that is a possibility again. Yeah, it's been pandemic has prevented that, but I'm also looking for the next work meetings here in Cape Town for you to come. I'm looking forward to that indeed. And thank you very much for your presentation. It was very interesting, and also enjoyed your perspectives on the way forward, which is very important, for our collaborative research, and that's fantastic. And so thank you very much for presenting. And I also want to thank all the participants and the input for the interesting input, and for attending the meeting. Thank you very much. So I'll call the meeting to an end with that. Thank you.
Thank you. Thank you so much. Bye-bye.